Hi and good afternoon. We're gonna wait for a little bit of at least a minute or two more just so that we can let everyone join the call. Also, trying to bear with me to try to make sure I can receive a participation list for today's meeting. So we'll just give it a minute or two more and then we'll begin.
Miriam, I'll try to get a screenshot of it.
Oh, okay, you have it.
I'll just get a screenshot for you and email it.
Perfect, thank you. I said it was supposed to be listed in the settings, but it's not there. So fun time. All right. Well, let's go ahead and get started. Good afternoon, and thank you all for joining me. This is the 2024 freestanding ambulatory surgical facility known as the FASF Survey Refresher, the afternoon presentation. I am Mariama Simmons, the Chief of Outpatient Quality Reporting Initiatives within the Quality of Measurement and Reporting here at the Commission. I have my wonderful colleague, Dr. Sinitra McCannon, assisting me with the presentation today. So as I'm presenting today, please feel free to ask your questions. I'm sorry. Everyone is muted, but feel free to unmute yourself and ask your question, or ask the question in chat, and we'll make sure to answer your questions as we're going along. All right. So in this in the presentation, I will be giving you an overview of the survey, giving a live demonstration, and then answering your questions. As we all know, the survey is required by state regulations. And so it's required by COMAR 102404, which requires all licensed freestanding surgical facilities to complete an annual survey with the Commission. The purpose of this data collection is to maintain a level of transparency and oversight of all licensed surgical facilities across the state. The data collected from the FASF survey is used to help make decisions in the planning needs of the Certificate of Need program. And these needs are include but are not limited to ensuring that Marylanders have access to high quality healthcare surgical services regardless of the jurisdiction they live in. The data collected also helps consumers make informed decisions about their healthcare. We use various data results and we publish them on our Commission's Consumer Quality Reporting website. So this link right here takes you to that. I'll pause again and say I will make the recording and slides available after the presentation. I'm going to do a combination of things from the morning presentation. And so you will be able to access the Consumer Quality Reporting website where you can see how your data is used. On the Consumer Quality website, we also have data about hospitals, nursing homes, and a host of other resources. So I recommend in your time you share this resource with your colleagues, with your staff. It is a very useful tool. So as a survey administrator, you all know that it is my goal to minimize your reporting burden because I understand that everyone has a lot on their plates. So as I try to minimize your reporting burden, please understand that my work is also important when I review and analyze the data that you submitted. It is very important that you provide accurate and correct information about your facilities and the populations that you serve. For calendar year 2024, the survey was revamped to include questions that will help the survey better align with requirements of the Certificate of Need State Health Plan. Before I review those changes, let's go ahead and talk about the things that did not change. So if you've ever done a survey with me in the past, you know that I pre-populate sections of the survey where we do not expect data to change from year to year. This includes information such as the operating and procedure room configurations at your facility. When looking at pre-populated data, it is very important that you always check and verify that that pre-populated information has not changed. It is your responsibility to ensure that that data has not changed. If it has changed, make the changes on the survey. The survey software has internal checks to ensure that you're providing the information that we're seeking. So for example, there are fields that only accept numeric digits when we're asking about numbers. We have a calculating and summing feature in the financial data section so that the data that you provide is automatically calculated for you. You don't have to add it. We also require, in instances where there are subsets of data that need to be, questions that need to be answered, we require the subset of questions if you answer the first question in a particular way. The system has error messages. So if there is a question that is not answered correctly, it will give you a message at the bottom of the page noting that that question has not been answered and bring your attention to it. It is my goal to hopefully bring that error message up to where the question is actually located, but that is in for a future iteration of the survey. You can always complete the survey at your own pace as long as you save your work. If you are waiting for data or information from other sections within your agency, such as a budget or finance department, please just make sure to complete the survey for the sections in which you have information on. It's much easier to come back and just complete one section of the survey than it is to scramble to complete all the sections by the due date. So if you have to wait for information from other people in your agency, please just try to complete what you can and save your work. In the utilization section, there is an upload feature for the CPT and zip codes. I was very excited to launch that back in 2021. And so for the 2021 reporting year, there's an Excel file that has been formatted that allows you to enter just the CPT or zip code data and case count for your patients. And that information can all be uploaded into the survey so that you're not having to manually enter hundreds and hundreds of data points. So what I will say about this, that sometimes that section can be a little bit finicky. So if you are having difficulties in completing an upload, it's try it. If it doesn't work, give me a phone call, give me an email, I'm sorry. Email me the Excel sheet that you're trying to use with your facility ID, and I'll take a stab at it. I always check to see what error is coming up with the system, and if I can fix it, I upload your data, I let you know. If I run into issues, I always communicate those things with you. So don't spend too much time if you're having upload issues, but just get the just feel free to ask me any questions. So there are other areas of the survey that are very familiar, and so let's just move on to the new updates. They're listed here on the slide. So some things as of the 2024 survey that you'll see, I actually think will be much clearer and easier to understand as I'm doing the demo, which is the next slide. So I'm going to move into the live demonstration for you all of the actual survey for this part. This is my test application, so please bear with me. It's still being, we're working on the last bit of cosmetic changes and updates to it, so bear with me. All So we're gonna log in as if you're a new, as you're coming to complete the survey. And even I too have login issues sometimes, as you can see. So now that we have the right survey, right login information, I'm gonna walk you through the survey as it stands, and then also go through over some of the changes by section that have occurred. When you get to the main landing page here, the most important thing to always remember is the system tracks when a section is completed and validated, meaning that all the answers are received, and according to the system, the questions have been answered the way they should have, by providing you a green check mark to indicate that that section is completed. This is my test account that I did go ahead and modify before you guys got here, so everything is checked off and ready to go. In the facility contact page, we did not make significant changes here other than taking out the facility fax number. We realized that maybe faxing is an antiquated way of doing things and no longer serves our purposes. So we removed that fax information. There's no other change to this page, but I always want to remind you that if you are retiring, or you know that you're leaving the facility soon, in terms of the next year, somebody else is going to do the survey, please email me that information so that, or if someone's going to take your place and will not be there for questions, give me that person's information here so that I have the most accurate contact. Okay. So then we'll go to the next page of the survey, which is our facility contact information. I'm sorry, which is our facility operational status. So in this area, we've added a question about ownership status within private equity firms. We are learning that there's an influx of private equity firms and other industries such as nursing homes. And so we want to begin to understand how the ownership structure impacts freestanding surgical facilities around the state. So there has been a question here added to the survey that asks for you to identify the name and the percentage ownership of any private equity firm that has a stake within your organization. So it's just like the other questions, like if your facility had physician partners, you would add the physician's name and the percentage of ownership and just add it, okay? I don't want the system to lock me out, so I'm going to say no again. But this is a new change here. It's the private equity firm question. I want to draw your attention to a set of questions here that speaks to how the facility operated for calendar year 2024. I know some people call and or email me back and say, well, my facility closed in 2024. I am still required to gather information if your facility was open for any period in the calendar year that I'm collecting for. So if your facility did close within the calendar year that I'm reporting for, you would just select yes, identify the date in which it closed. I'm just picking a random day, hit save, and when you hit validate, you will notice now that all my stuff that I had before is unvalidated, because the system is going to ask me to verify and check the information here in question part 2, which is the room configurations. So room configurations, and that should be opening. It wiped my information. Good talk. Okay, so let's do that. I'm just gonna answer no for that and then save. Okay, all right. This is why you don't play with things. Okay, guys. So anyway, I'm just gonna put in some numbers here to answer these questions so I can validate this page and show you that this would have been pre-populated before. And so then I would just be able to move on. These are just to get the survey moving. Okay, that should be it. I have 3 rooms. Okay. Okay. Now I should be able to hit save, and I missed something. See, the system will let you know you missed something. Saved it. Great. Now I can come back, and my validate button should be activated now, which it is. I can click on it. Before it was grayed out. Please indicate if I was a multi-specialty, because again, it cleared out all my data that I had done. So I'm just going to pick some specialties and hit save and hit validate. So now when I get here, the survey should have moved me out and say, your facility is closed. You do not have to do any further actions, but I broke it somehow. So bear with me on that one. All right. That was not good. Okay. Okay. Well, that was, so if your facility closed, it will work very much more smoothly. You will be prompted to check the information in part 2, and then you can certify your survey. So I'll move on to the next section where we made changes, which is part 2, services and administration. Most of the questions are the same. We did add specialties that have been written in the past in the other field have now been called out, such as dental, neurosurgery. Those are 2 that have been called out, and then changing and updating some of the names of these specialties so they're more reflective of the names that you all use in the industry. So that was like a little bit of a minor change. Another change that we made here is we're interested, knowing that Maryland is so centrally connected to other surrounding states. We've asked a question for you to identify practitioners such as your surgeons and anesthesiologists, if they have providing privileges in the surrounding hospitals and within other states. So you would just answer that there. Another question that was added here on this page is only for facilities that have at least 1 operating room. We added a question to identify what type of operating room it is, whether it's a special purpose operating room. And this helps to align with the requirements for our Certificate of Need program. And so if it is a facility that has a special purpose operating room, such as where you do cesarean sections, you would answer yes, and then you're able to type in the type of tools and equipment used to for this in that facility in that operating room to make it a special purpose operating room. Okay, and this is only required if you answer that you have at least 1 operating room. If you don't have an operating room, you will notice that that question does not even appear for me. So when you guys open your survey, for those who have at least 1 operating or more, you'll see that question. But if you do not have an operating room at all, that question will not appear. Okay. So then we move on to the utilization. Then in this section, we added questions here that are helping to support some of the changes that we've made in our, again, Certificate of Need process, where we're talking about equity and social determinants of health of our patients. And so there's a question here that's added. As you can see, this is grayed out. There's a new question here. We want to know how many days your ORs are being used, your operating rooms. But as you can see for me now, this question is grayed out and I cannot provide an answer. And that's because on the previous page, I answered that I did not have any operating rooms. So I'm going to go back and change this to at least say 1 operating room so that now those questions become activated. And I'm just going to do that real quick so that we have that information. As you can see, the validate button here did disappear. That's because you have to go back in here and just hit save, and the validation button should reappear. So now that we are, we've added that we have an operating room, at least 1. You can see now I can add, I'm free to add data. So I'll say that I do, I have to add cases. I'll say I I did 500 cases, 500 in my operating room, 500 in my procedure room. Each of them take about an hour to complete, so it's 500 hours. If you do calculate your time in minutes, please remember to make the conversion back to hours. The question is asking for hours and not minutes. So I know a lot of you all maybe do OR minutes, but if please just convert those minutes back to hours. So I'll put here, we're open only 3 days a week, and we're going to calculate for some, we have a closure that we calculate for our staff having vacation. So I'm going to say out of the 365 days in a year, we only operate for 265. So I'm going to put that there. Again, I do apologize because all of this was already set, but I reset it apparently when I did my changes earlier when I was trying to show you something else. But I just want to put this here so this doesn't stop me. I'm supposed to have 500 cases, so this would have to be 300. All right, so now I have my 500 cases. I'm so annoyed. I guess this is a good way to show you guys. Let me hit save. This is a good way to show you how the upload feature works. My data was saved here. It's no longer saved. I have some files that I've used in the past for my CPT and data tasks. So I'm just going to upload that information real quick. And as you can see, it uploads the data for me in my pre-formatted Excel sheet. So I can save it, come back out of it, and now go here. My zip code data, same thing. This tab right here, hopefully it does open it in a new tab, and it did. So this is the formatted Excel file you can use to enter your data. It already has the zip code and cases on there. So you can use that to get your data. Sumitra, can you let me know if I am still presenting my screen? Yes, okay, perfect. I can see. So again, I'm gonna try the upload feature here because I have things that I'm testing that I believe work. That file was smaller, it's uploaded. There's a tracker at the bottom that tells me I entered 500 cases at the front of this page. I should have 500 zip codes, and I do based on the values presented there. So I'm going to hit save just because it's always important to save your work, and then go back to part 3. A set of new questions that we are creating, again, for the purposes of equity and aligning with the commission regulations, is that we have added questions as to understand more about the patients that you serve. So we want to know if you, the patient demographics, so these are unique individual counts for age, race, and insurance status of your patients. So you would enter those values here. Again, there was data entered here, but just gonna make it easy. This is the population of people I serve, and make it even easier. It's the way my population is. Most of my people have government assistance, and then if the rest of them are self-pay. All right. New question here again. If your facility has done any corrective or revision surgeries within the last year. Again, since I'm allowing for questions, Sumitra, do you want to let me know what we have so far?
Sure. The first question is from Brianna Smith. It says, will there be an unknown option for race?
Yes, thank you so much. I should have mentioned that as you guys are looking at my screen. Based on my presentation this morning, my team is going to work to add a screen for unknown, yes. As well as we'll put an unknown under the government insurance status, even though since most people receive payments through some form of insurance, you should be able to identify what that is, but I also create an unknown category there.
The second question is from Highland Rep. It says, for revisions, is it by the same surgeon or same facility?
Perfect. So we are going by your facility. As I was about to explain, for your corrective or revision surgeries, you're only reporting surgeries that, one, were initiated at your facility. And also that the revision is being done at your facility. So even if you know that a patient is coming from another doctor or another facility, unless the initial surgery was done at your facility and the correction is being done at your facility, do not count that case. It has to be it has to be initiated at your, the initial surgery has to be done at your facility, and the correction has to be done at your facility. Also, some of the caveats, and I'll be preparing a document more to give you guys guidance on these topics, especially this question, because a lot of people had questions for this on the first session. Where a revision is any change, or revision or correction is any change that occurred initiating at your facility and being corrected at your facility that, one, was done for any reason, but it also must follow these parameters. So the initial procedure was done correctly as according to medical practices. It was also done in completion. And I say this because a question about colonoscopies was brought up in the morning session, where if you are starting a colonoscopy and then you later learn that the patient didn't do everything that they were supposed to do in order to make sure that the colonoscopy can be completed and you have to stop, then that is not considered a full, complete surgery. You didn't complete that process. So you wouldn't count having to tell that patient to come back in the next time as a revision because the surgery wasn't complete. Okay. And also ensuring that this is not a surgery that was coming up as a series. So someone is having some type of knee replacement, but it's going to have to be done in stages because of the age or condition of the patient. You would not count that as a revision or correction because that is already a pre-planned set of procedures that you're going to do. The revision surgery has to be done on for the same condition on the same body part or organ. Okay. So you would only count those instances where you're doing the same condition, redoing the surgery for the same condition, the same body part organ that were done. The initial surgery was done correctly and completely, and it's not a part of a planned series of surgeries. Okay. So as we move into after utilization is where we just were, we move into financing. In the finance section, we didn't make too many changes here. A question has been asked about the total number of operating expenses for this section, though, just to align with the reporting of charity care in our state health plan. And so we want to know the total operating expense. How much does it cost to make your facility operate? So that number right now is not tied to any of the other financial data, but we do want that number. So in this case here, I'm so mad that my information was wiped out. I think I had put like, what's that? 50,000. Rounding all the way up to whole numbers as always. We make $1 million. We accounted for 300,000. And then I'll come back. So that was the only change that's made on this page. So let me just quickly get to $700,000 real quick here. I'm going to make it easy for myself. That's 50,000. 50,000. Yeah. Oh, this is, I'm gonna make this more. I'm sorry, guys. I have one category of payers that gave me 700,000. Okay. Yep. It's angry. All right. Because if you don't see that it's saved, you always see that message that pops up that it's been saved. I'm just going to click off of it real quick, come back into it. You can see my information was not saving. I make it even easier for myself now, y'all. $20. Data saved. You know your survey saving, and then I can validate it. That section is now marked off as completed. You might be asking, Mariama, where did your arrows go? I just have to go back and click validate on each of these pages. As long as all the questions are answered, they should pop back up. But for now, we'll move on to the last set of changes which were made in our patient safety and quality section. This has just a slight name change from the previous survey. Also, we wanted to know if you are reporting for the federal program of, there's a push for all freestanding surgical facilities to begin reporting within the outpatient and ambulatory surgical CAPS survey, which is, CAPS is a consumer assessment of health plan providers and systems. And this is collected currently for various other industries, such as hospitals. So we've added a question here to determine how well you are aligned with that, or if you're not at all. So that's this question. Just to make this easier for me and not make it angry, I'm going to answer no to those questions, because as you know, if you answer yes, a series of sub questions comes down. But I'm just going to make it easy for myself and say no. Total joint, the Joint Commission accredits me. I have 10, and all my staff was vaccinated. This is the annual flu section. I have a mandatory vaccination policy for my facility. And then lastly, this is where the last bit of edits and changes were made, is we're trying to really understand how social determinants of health are impacting our consumers. So we understand that there are different environmental factors where we live, work, and play that impact our overall quality of health. And so we're just trying to understand from surgical facilities, how well or how much have you started thinking about those social factors, or even addressing those social factors that are impacting your community. So at this time, is your facility set up to address? And I would say I agree. How often am I doing it? So we do a questionnaire where we ask social determinants of questions every time a client comes to us. So we're asking about whether or not they're having issues with nutrition. We're asking if they have transportation needs. So, and in my facility, I'm going to say we do that every time. So I'm going to say always. And then I can identify here, because we have a translator, all these things that are applicable to my facility. This section will be updated. This is supposed to be an area where you can actually type in other activities that you might do to help support your patients. So that is a change that I noted from the morning session that needs to be made to my IT team. So again, the social determinants of health are conditions and environments where people are born, live, work, and play, and worship. And this definition we're using that comes directly from the Healthy People, CDC's Healthy People 2030. So we're trying to align with that. So now that I've completed those sections, those are the things that are new. One thing I'll remind you guys about is making sure that your survey is always ready to be submitted. When I do my tracking, I sometimes have to send emails and people are like, well, I completed that weeks ago. You know, can you check that you got it? When I run my reports, if you land on my report and the status of incomplete, it means that you probably failed to hit submit. And I've had that happen. I'm sorry, hold on, 15. I've had that happen quite a bit. Okay, I had to read the error. So sometimes, yep, that does not make sense, right? 250 plus 250 is 500. The system had a check at the bottom saying that that did not match. It wouldn't let me validate. Now I can validate. All my questions are answered. I have the green check mark. Please remember to hit submit survey. Once you hit submit survey here, there's another submit survey. So you want to provide your name. My title is nurse manager at this facility. And this serves as your electronic attestation that the information that you've provided is accurate. You can give me feedback if you would like. I always take them. I do actually read and try to incorporate your feedback so it doesn't just go in dead air. Once you've done that, you can hit submit survey. You will receive a page that says your survey has been submitted. Please always print a copy of it. When you click copy, you can see that all the answers that I've entered into the survey come into this form. At my office, we print by actually doing a save as. So I'm going to save this. I'm sorry, we print by clicking print and print it as a PDF document. And that way I can save a copy electronically of my survey for future reference. Or if Mariama decides that she has questions about your survey and she calls you next year sometime and asking you questions like, I did that last year, so you'll have a copy for yourself. Okay. So now that we've talked about the survey, I'll give you some few tips to remember as always. Always save your work. Save, save, save. You cannot oversave. If there, you can, again, complete the survey in sections. So make sure if you're completing it in sections that you save your work. I will send out reminders when we're approaching the deadline if I don't have your survey as received. If you received your survey, if you think you've submitted your survey, go back and check to make sure and that you've clicked the survey button. I'm available to you when the survey opens, so please do not hesitate to contact me. Email is the best form of communication, even though I do take phone calls. So feel free to call me and I'll walk you through whatever's needed. If you need to make requests from other units within your facility, please make sure that you make those requests early. Like as soon as you know that the survey is coming on, please just tell them, hey, I need the 2024 data for our facility, and so that you're not waiting for them to provide it at the last minute. If your contact information changes, let me know. The meet and greet, what we're all here for is, Mariama, when does the survey start? My goal, barring any catastrophic technical issues, is to launch the survey on Monday, August 4th. You will receive an email with your with your login information on August 4th in the morning, and you will have access to the survey. As required statutory legal through our requirements, I have to give you 45 business days to complete the survey. I have accounted for the state holidays that fall within those 45 days. So the survey will close on October 6th. Okay, so 45 business days. This is an electronic application. It's open on the weekends, so it doesn't close. So technically you have more than 45 days. If you I hope nobody has to work on the weekends, but unfortunately, if you are feeling restless on a Saturday and you want to get into it, you can access the survey. But 45 business days is what I have, and the survey will close on October 6th. So as I said, there are always resources available to you all. I post the resources on our consumer quality website. I want to see if the link will take me there, because I'm very proud of our website. So you have information here as how, if you are new to the system and you've never seen what the survey even looks like, there are copies made here. There's an upload tool. There is background as to why we do this. And there's an FAQ that will be updated as well, all available on the website. Also, if you're just very interested, this has to be updated. I have to work with our contractors. The data is current, is as of 2023, which is the most, outside of this year, is the most current data, because we allow you all 1 year to close out your financial data. So 2024 is the most recent year that I'm collecting for right now. So the technical survey guide is located also there. But on our webpage, I want to return to the main menu, which I have to log off. The survey guide would also be located here. So you can always have access to it. You can download it here. It's going to be updated. And if you have questions as you're working on your survey, you can download those. So I'm at the point of the presentation where I show you my contact information, ask you if you have any questions, reassure you that I'm here with you for the process. Some of you all are my veterans who have done this for many years. Some of you might be new to the process, and so I'm here to assist in any way that I can. As I stated, email is ideally preferred, but if you do need to call me, I'm offering you my office number and my cell. My office does operate on a hybrid schedule sometimes, so sometimes I may be teleworking, but feel free to call me. So I'll ask Demetria if we have any questions from our chat, and then we'll go from there.
No, there's no additional questions.
Well, guys, we have a few minutes. I guess I'm presuming that maybe you didn't want to type up a question, but if you do, because I had quite a few questions from the first morning session, but if you have any questions at this time and you want to just unmute yourself quickly, please do so and ask your question. Okay. Well, I'm seeing that people are leaving, and so it doesn't seem like we have any more questions. So I thank you again for your time. I thank you for listening, and always encourage you to ask any questions that you might have. I'm going to go ahead and close the presentation, and I'll give you back 15 minutes of your day. All right. Thank you all so much. I really appreciate it.